Eldoret in Uasin Gishu County, a region with a dubious fame for many backstreet abortions.
Up to 58% of women who present to our hospitals, they present with a complication. They will rarely tell you that they were performing, they were trying to procure an abortion. Most of this we make through discoveries. As we manage the complications, you come to realize that there are problems.
A national study by the government in 2012 established that about 465,000 women had induced abortions that year. Out of those, 120,000 women received care for complications in different health facilities.
Because of shame nitakuwa nayo, marafiki kama take the wrong decision. So, vile nilitoka, placenta ilibaki ndani.
Nearly a quarter of the 465,000 women who sought abortion were treated for related complications.
Operation ya kwanza ilikuwa na a lot of challenges cause vile nilitoka huko kifua ilifungana, nikashindwa kupumua, wakaniweka oxygen for 1 day. After that, vile sikuwa natembea juu nilikuwa tu nalala kwa kitanda, mguu ikafura, damu ilikuwa imeclot kwa mguu. So hata hiyo dawa bado nazitumia kufanya damu ikuwe sawa.
Some of the reasons are very sad. It's for the same morality that we are fighting for. For instance, somebody will tell you, my church pastor cannot agree that I'm pregnant.
Article 26 of the Constitution states that, and I quote, abortion is not permitted unless in the opinion of a trained health professional there is need for emergency treatment or the life or health of the mother is in danger, or if permitted by any other written law.
What we now know for a fact is that abortion happens in this country, and it happens even with the ideas of the very high and the might, and very high in religious kind of standing.
Sometimes unsafe abortions lead to heart, renal, or even kidney failure. These extreme cases can only be managed in 2 public health facilities, Kenyatta National Hospital and Moi Teaching and Referral Hospital.
But you see, what we lack in these places is that there needs to be a supportive system for them to understand what they are talking about. For instance, it's not just enough to abort. There are psychological aspects attached to it. Once somebody has lost a pregnancy, of whichever nature, whether it is induced or it is spontaneous, it's not easy. It becomes a lifetime event.
At 16, Margaret was more concerned about falling pregnant than getting a disease.
We've seen all kinds of complications, and I can tell you, one of the most emotional one was, I think, 3 years back in some facility, which I might not have to reveal. We had to remove a uterus of a 14-year-old. This is because the clandestine abortion had been performed on this girl, and the uterus literally got rotten. And what that meant is, we were thinking that there's something inside, only to realize that a rotten uterus doesn't feel pain. So in the end, when we went to theater and we had to remove this, it was very sad.
That option, reproductive health experts argue, would have come in the form of standards and guidelines on safe services. The government withdrew the standards and guidelines for reducing morbidity and mortality from unsafe abortion in 2014, reportedly under pressure from the Catholic Church.
We are told either it's political or religious. I mean, there are people who feel like the guidelines are, encouraging abortion on demand. But what we know, abortion is happening. We consume a lot of resources in the hospitals in managing this kind of patients. And one patient can actually consume resources for the whole ward all over. And what we've been dogged with doing as healthcare providers, or rather, doctors, is managing the very serious complications arising from clandestine abortion.
For Citizen Weekend, I am Anne Mawade.